today's topics from an African American perspective. This is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Hamm Lee. We're here talking about Another View on Health with my co-host, Dr. Keith Newby. Hi, Keith.
How are you? I'm doing fine. And yourself?
Great. It's good to have you back. Guess what I did last night?
Oh, I'm scared to ask that. What happened?
I am so very excited. We actually had a live taping of the Jefferson Hour here at WHRV, and I had the honor and privilege of being the host and having the opportunity to interview Mr. Jefferson, along with her impersonator, Clay Jenkinson. And
I was going to ask, that was a neat trick if you could have pulled that one off.
It was a great show, and the show is going to air in a couple of weeks. But one of the things that Mr. Jefferson said, which I thought you would be interested in, because I know beyond your medical practice, you also are very involved politically, and that is, he said that all citizens should do more than just pay taxes and vote, but that it is important for them to vote. And I know we've got several elections coming up soon, and you wanted to say a couple words about that.
Well, I know the main one, of course, is this in the Norfolk election coming up May 3rd. We have some council seats up and a mayor election coming up. And I do want to encourage people, I know we kind of get excited about the presidential elections, and I understand that, and of course that is important, but a lot of people tend to blow off the local elections, but most of the policies that are going to affect us
day to
made
day.
there. And I really want to encourage people to come out. May 3rd is the election. I think it's April 11th is the deadline to register if you're not. So if you're not registered to vote, make sure you register and come out and make a difference. A lot of people think they don't make a difference, but they do. Anytime and it's really kind of hard to sit on the sidelines and complain if you're not taking an active role.
And there's also elections in the city of Norfolk, Portsmouth, Hampton. I believe all of the cities may be having an election this year, so everyone needs to make sure that they register to vote.
Do not sit on the sidelines. It's easy to do that, but then you're not making a difference, and you're not impacting on you or your family's life by sitting on the sidelines.
And there are a lot of health issues that come through our governmental processes that we need to be involved in.
Yeah, very much so, and that's everybody has those complaints about health care and health care delivery. But if we don't start to have people in office that care about health care, then things are just never going to change.
Okay.
So in order to get there, we got to get out there and vote.
All right.
Well, my public service message for today.
And we thank you for that,
thank you
sir.
very much.
So today we're talking about Parkinson's disease. It's a neurological disorder that, unlike many diseases, affects fewer African Americans than whites. That's the first for some of the topics we've talked about, Keith. But blacks suffer greater disability and more severe cases of Parkinson's, many times because they ignore the symptoms. So here to tell us what we need to know about this disease and its impact are Dr. Carmen Fuentes, who's a neurologist with neurology specialists. Hello, Dr. Fuentes.
Hi, happy to be here.
Thank you. Thank you for joining us. And also Dr. Nicole Donaldson, who is a family practitioner with Fort Norfolk Plaza Medical Associates. Hello, Dr. Donaldson.
Thanks for having
How are you?
me.
Thank you for being here. Larry Dumville is a retired attorney who is living with Parkinson's today. Hello, Larry. How are you?
I'm fine. Thank you for having me.
Thank you. Thank you for being here. And finally, Don Bradway, who is the advisory board president of the American Parkinson's Disease Association, Hampton Roads chapter. Did I get it?
Yes, you did, Barbara. Thank you much. Thank you for having us.
Thank you so much for being here. So I just want to start out with, and Dr. Fuentes, I'm going to start with you. What exactly is Parkinson's, and how did it get its name?
Parkinson's disease is a brain disease that it's progressive, it's irreversible. It affects an area of the brain that is called the basal ganglia that deals with a chemical, a neurotransmitter that's called dopamine. And that transmitter relates to our movement, our thinking
process. So it
process.
tells us how to move, how to think.
Our learning process. So it's a very important chemical. So part of the symptoms and the main symptom involved would be the slowness of the movement. Okay. As of how is it acquired, we are still not sure how. The thought is that it's a mix. A patient has the genetic predisposition, either DNA related, right, to develop the disease, or there could be an environmental cause in addition. Sometimes it's a mix of two. In several cases, about 10% of the cases, it could be genetic. So that means that there's a particular gene that's passed through the generation. And that's
so when you diagnose it, can you tell from that point what may be the cause, or it's just not
necessarily.
known?
We do have to exclude certain things that can mimic Parkinson's disease.
So, Dr. Donaldson, since you're a family practitioner, I would imagine that you would be a first-line practitioner or medical person who would see someone who may be exhibiting symptoms of Parkinson's. What do you see?
So normally when a patient comes in, they're complaining of, they come in and they complain that I've been falling, I don't really feel like I move as fast, and then things that I notice is I'll say something funny and their facial expression doesn't change. Or when they walk in, and I normally when I'm looking around, when the patient's walking in, I try to see what they're doing when they're walking in, and they shuffle. So there are people, they're not going to come to you and say, I think I have Parkinson's. But it's normally kind of that sense that you're looking for certain things, and when you don't see it, that's the indicator. So typically they're moving slowly, and their affect or their facial expression is very flat.
So, Larry, can you tell us your story? Like, what happened when you first started receiving symptoms? What were you thinking? What was kind of going on in your life at that time?
It was very frightening. I had most of the symptoms, the shuffling walk, the walking in the mall and having my family get ahead of me, and I could not catch up with them, just could not walk as fast. But with my left hand, the fine motor skills in my left hand, I could no longer shuffle cards, handle money. My son would take my wallet from me and take the money out to pay the bills.
Because your hands would be shaking too hard?
Shaking, or I couldn't even get them to close up on the dollar bills and things.
Do you remember what the first thing was that you thought, in your mind, even before your family or anyone may have noticed, but you said to yourself, wonder why I'm doing X?
It was in a trial, and I was handling a witness, like the doctor, some papers, and to get to the page I was looking at, I couldn't get to the page, and the doctor was kind enough to say, Mr. Dumville, I think I know what you're referring to, and he saved my bacon.
I never heard that quite expression.
And did that make you immediately go to the doctor, or did you just say, something's just not right?
What made me go to the doctor was my wife said, something's wrong. I kept saying, you need a hearing aid. She says, no, you're speaking too softly. And my son said, Dad, I can't hear you either. And so it was the loss of the voice that really brought me to go to see primary care doctor, and then.
Do you remember what did the primary care doctor do in terms of testing, if you will, to figure out if that was in fact what it may be?
Basically, it was putting your fingers together and seeing the amplitude and the speed of the hand movement, and says, I think you need to see a neurologist.
How long have you had it?
I was diagnosed May of 2009.
Okay, so that's about 7 years.
7 years.
Yeah. Has it gotten progressively worse? Is it the same?
Well, medication improved the symptoms for a while, but then it is progressing now and continues to get worse.
Okay. Now, Don, you have your wife, I understand?
Yes.
Has Parkinson's.
Yes.
What was the same kind of type of questions I was asking Larry in terms of what you all noticed first? What was she doing? What was life like prior to?
The primary symptom initially was that her left arm didn't swing when she walked. And it was very obvious that something was wrong, that, when you walk, both your arms swing along, and her right arm was going back and forth, and her left arm was just hanging down at the side of her body. And that was a symptom that actually talked to, I think, her primary care, but very quickly got to a neurologist and went through some testing, and as Larry said, with the finger movements and those types of things to identify that she was a person with Parkinson's. And put her on some medication, which initially was relieved that symptom. Funny thing is now her left arm's swinging now.
Wow. So that came back.
Yeah, it did. Well, it has come back, but I mean, she has other issues that have continued on in its progression. I think one of the things for Larry and my wife that we'll talk about medications possibly, but exercise being such a key ingredient of a person with Parkinson's. To exercise, it will slow the progression.
Wow.
The data is out there that shows that the way to slow the progression, and will progress, but to slow the progression will be exercise. And so we advocate that for anybody with Parkinson's disease.
440-2665 or 1-800-940-2240 are the numbers to call. Give us a call. Do you have Parkinson's disease? Does someone in your family have it? And you'd like to share with us what's going on with you all and how you're coping. We would love to hear your story. 440-2665 or 1-800-940-2240. So, Dr. Fuentes, the testing that both Larry and Don talked about, tell me a little bit about that and what you're looking for as you're making your diagnosis.
Or believe it or not, the diagnosis of Parkinson's disease is still a clinical diagnosis. So meaning that there's no blood work, there's no spinal tap, even if we order an MRI. That would rule out other causes that may mimic Parkinson's disease, but it's not diagnosis or diagnostic of Parkinson's disease. So it's pretty much a medical examination. Mm-hmm. So we're looking, as she said, for the facial expression. We're looking mainly for the slowness of movement, which we call bradykinesia. We're looking for rigidity. We're looking for the reduce in the blinking. We're looking for the slowness in the walking, for the reduce in the arm swing. We may be looking or seeing some shuffling, that short step, short stride. Those feet don't want to really get from the floor. The feet may get stuck in the floor. The soft voice. So we're looking for all of that during the examination. Mm-hmm. Some patients have tremor.
So just out of curiosity, when you're doing that, was that somewhat like certain rheumatologic disorders where, like, you talk about lupus or other things where you may have to have a certain number of symptoms that says, oh, yes, they have this? Because I know I've seen people with just essential tremor, and they're saying, well, they do not have Parkinson's, they just have essential tremor. So is there like a certain number of symptoms they have to demonstrate, or is it pretty much all those ones you
Yes,
outlined?
We do start with something that we refer as a Parkinsonian syndrome. Mm-hmm. So that's pretty much defined by somebody that's slow and that may have the rigidity or tremor, or when you pull them back, they sort of lose their balance, okay? And they need 2 out of 3 to fit into this Parkinsonian syndrome. Depending on what other symptoms they may have, orthostatic hypotension, the blank facies, the reduced arm swing, depending on the other symptoms that they have, other medical conditions. This is a patient that have had many strokes in the past. This is a patient that have urinary problems early on. We are able then to rule out exposure to heavy metals, right? Then we would order any other appropriate testing to rule that out. But once we establish that there's a Parkinsonian syndrome, and we rule other causes that may fit into that, then it's probably a Parkinson's disease.
Dr. Donaldson, one of the things that I found in our research, and I said in the intro, is that a lot of times African Americans suffer worse, if you will, because they wait so late for the diagnosis, that they think this is just getting old, or, this is just the natural progression. Is that what you find? And what would you say to people in terms of, you don't want to over panic, but at the same time, they need to be aware?
Well, I think there's some factors that may be a little bit challenging. Some of it is socioeconomic status, lack of insurance. Some of it is fear that I've had patients tell me, I don't want to come to the doctor because you're going to always give me bad news. Mm-hmm. So some of it is that there is some, unfortunately, mistrust of the healthcare system. And so people delay it and they figure it'll just go away. So those are things that I always try to encourage, my patients. You want to empower them and you want to get them to understand that you can't deal with issues that you don't bring up. So once they're in the door, you're set. So what I would encourage people listening to do is, if you have these symptoms, don't wait until they get too bad to where the medications become less effective.
Mm-hmm. And I want to talk about medications in just a moment, but Dan joins us from Norfolk. Hi, Dan. You're on the air.
Yes, my question is this, and I've researched it, and under benefits of drinking coffee, one of the points they made, if you drink 3 or 4 cups of coffee a day, your chances of getting Parkinson's disease are very, very low.
I'm going to let the panel answer this because I think we've got 1, 2, 3, 4, 5 different responses to your question, Dan. Thanks so much for the call. Dr. Fuentes, I'll start with you.
Yes. What the study has showed is an inverse relationship between coffee drinking and Parkinson's disease. So the information is very conflicting. And there's no recommendation from our standpoint to increase the amount of coffee. I would say, and I may
from a
share this with Dr. Newby.
I think all the coffee drinkers in the world unite here. But, I tell you what I find interesting is like when you read studies, I always see this relationship to coffee and something. And I notice all the coffee lovers they want to show it's not bad to drink this stuff. But, what I found in research is that, as an ex-Duke guy, where that was our principal motif was research. A lot of times when you're getting data, you get data and you say as an example, we were doing a study looking at heart attacks and cholesterol. Okay. Well, they'll collect a ton of data. And so then after they collect all this data and they answer the initial question, then they'll say, okay, we have all this data. Let's ask some other questions. We have this. So let's see how many people with heart attacks and had heart, with high cholesterol are 4'9" tall. So then all of a sudden, then they start to kind of look at that data from a different angle. But the problem is a lot of those studies weren't designed to answer that particular question. And then so sometimes you have to be careful when they come back and they look at this other data because again, the study wasn't designed to answer that. It may look like there may be a trend, but that wasn't the original study. So sometimes you got to be careful with that. That's why I tell people don't just believe every study you see.
Larry, you want to say?
I was a 5-cup-a-day coffee drinker, and it didn't help me.
See, there you go. So you can tell. Then did you want to respond to, Don? I saw you smile when you heard the question.
I think some of it, to Dr. Newby's point, is some of it is the nature of people that drink coffee. All of a sudden, it just pops up. I mean, the data's got to really be parsed very closely to get to those kind of results.
Now, people like Muhammad Ali, who was diagnosed in his 40s, Maurice White, who just passed from Earth, Wind, and Fire, Michael J. Fox, they've all come up very publicly with their disease. And has that helped in terms of awareness done and maybe fundraising for research, or does that help at all?
Absolutely. I mean, Michael J. Fox certainly has been the most predominant because we see him still acting. Muhammad Ali is not still boxing, so he's not quite as prevalent out there to the community, though he is a name that people realize. But the donations for research have increased specifically because those people have done that. It's like Christopher Reeves when in the brain trauma issues. Remember, the giving for brain trauma went up dramatically because you have somebody of fame who is now afflicted with that problem. So we have done that. We try and push that. We try and get national funding for a lot of pharmaceutical research going on, but the research coming out of these nonprofits such as the Michael J. Fox Foundation, some of the others where Muhammad Ali is involved with the American Parkinson'S Disease Association, has been beneficial to help get some additional funding for even some of the startup studies. That's a lot of the areas where they really do need the preliminary funding before the big governmental dollars of the NIH really get involved also.
Okay, Larry?
I was going to address what Dr. Newby said about data. With Parkinson's, we don't even know how many people have Parkinson's. It's estimated between it's 500,000 and 1.5 million people. So that's a spread of 1 million people, which is a tremendous spread. And we do not have a national database on it.
Is that why I'm saying why don't we know how many people have it? Is it because a lot of people just go without being diagnosed, or I mean, are we just doing an educated guess? How do we get to those numbers?
Personally, I think it's a largely underdiagnosed disease because as people age, they tend to think the symptoms are part of aging. You know, my grandfather shuffled, so I'm shuffling now. It's just part of getting older.
I would agree with that. Misdiagnosis is a big part of the problem. And then there's so many codes Also, that agencies like Medicare, for example, may not pick them up. And similarly, patients are not going diagnosed, and there's young onset Parkinson's disease that then the Medicare database is also not picking up.
So that becomes. I want to ask you, Larry, when you think back to once you were diagnosed, because I know this was 7 years ago now, but tell us some of the thoughts that went through your mind in terms of what you knew, what you knew about the disease at that point, what you knew could potentially come along, et cetera. What were you thinking? And how did your family talk about it?
My family talked about it. It was interesting. My wife called my older son, who was in college at the time, and told him, well, Dad's been diagnosed with Parkinson's. We wanted you to know this. He says, oh, that explains a lot.
So he had noticed some things but never talked to you about it.
He had noticed it. For me, the diagnosis was a relief because I now knew that I wasn't going crazy. And then, most importantly for me, was a support group that kept me from going into a very dark place.
So you go to a support group and talk with others who have Parkinson's? Is that...
Absolutely. That's one of the big things that the American Parkinson's Disease Association has in Hampton Roads is support groups on the ground. I think we have 13, Don?
Yes.
13 support groups that meet.
Mm-hmm. And what's kinds of, if you can share some of them without giving away any secrets or anything, but what do you talk about? And what are some of the common themes that everyone who is in your group have experienced?
Well, the common themes are the importance of exercise. We talk about different medications and symptomatology, so you know you're not going crazy when something happens. Leg cramps. I was getting terrible leg cramps. One of the ladies in the support group says, oh, try this over-the-counter magnesium supplement, and it helps. So we talk about symptoms. We talk about what's happening career-wise, disability-wise, just anything. Ours is called the Let's Just Talk support group.
Were you about to retire, or were you near retirement when this happened? Or
absolutely not.
Okay.
I expected to work well past 66, probably to age 70.
So now you get to just kick back and relax. I'm teasing him.
pretty much. Pretty much.
He said pretty much.
I made a joke earlier about a tackle box, but I'm sitting there getting my tackle box organized, so I want to go fishing.
There you go. 440-2665 or 1-800-940-2240. We're talking about Parkinson's disease. What questions do you have about the disease? Are you a caretaker for someone who has Parkinson's? 440-2665 or 1-800-940-2240. Keith, go ahead.
Question, and I guess in a comment it could be looked at as both. As we talked about, the comment was made about exercise and its importance. My mother has Parkinson's, and I know I've had nerves with her for falling periodically, and it's just more of a sudden thing. So, you got to be careful at the same time when you talk about, the type of exercise that you do, because you could potentially, get in some trouble depending on what you're doing. So the question I would throw out to the panel would be is, what is the recommended? I know it's going to be variable because certain people have very low-grade Parkinson's. It's not really affecting them that much right now. There's some that are more severe. But just to the average layperson that's listening, is there something in particular, like biking, something stationary biking versus, is there some exercise that helps more than others?
Okay, start with Larry, and then we'll go to you, Dr. Fuentes.
I'm in an exercise class that is Parkinson's specific. Everybody in the class except one individual has Parkinson's, and we work with just a lot of balance and movement issues, shifting weight side to side, and some cardiovascular. We just recently introduced boxing into the program because you got to move your arms and legs and feet at the same time. So it's very helpful. But it's getting the balance because you need to work on that weight shifting.
Just before I get to the two of you, if you're just joining us, we're talking about Parkinson's disease with neurologist Dr. Carmen Fuentes, family practitioner Dr. Nicole Donaldson, Larry Dumville, a retired attorney living with Parkinson's, and Don Bradway, advisory board president of the Hampton Roads chapter of the American Parkinson's Disease Association, and of course, my co-host on Another View on Health, Dr. Keith Newby. So let's go to you, Dr. Fuentes, and then I'm coming to you, Don.
I need to say it's very important. It's mandatory that all Parkinson's patients do exercise. And the patients that have early disease, mild disease, the recommendation would be about 30 minutes 4 times a week of anything that's aerobic, lifting little weights, even if it's small, a stationary bike, walking, forcing that arm movement. So they stretching significantly. So all of that's recommended early on. Later on, as the disease progresses, balance starts to be affected. There's different strategies in terms of physical therapy that are directed specifically for Parkinson's patients. Big program, power program. There's different resources in the community too that are directed specifically for Parkinson's disease. There's gait training, fall prevention programs, and eventually really the goal is for that fall prevention, keeping the balance. And something important that the patients, as they get a little bit more advanced, is the goal of the therapy. It may not be necessarily, oh, I'm going to get so much better, but the goal is I'm not going to be worse, and I'm going to stay mobile, and I'm going to stay active.
Got you, Don.
Yeah, I think to Dr. Fuentes' point, I mean, it is a progressive disease, but start early. Don't wait until you're later. I've heard a physical therapist out of Boston University say she wished that every neurologist, movement disorder neurologist, when they diagnose Parkinson's, would give a prescription for exercise as well as a prescription for medication, because it should start that early. It should start immediately. The other thing is we tend to think of, we talk to Parkinson's about the extremities. Oh, it's the legs and the arms and those, but it's also the small muscles. It gets into swallowing. There are some exercises. The power program that Dr. Fuentes mentions is about swallowing. So a speech therapist is as important as the entire physical therapy, because swallowing becomes a problem. It is a muscle. It is all the muscles of your body that are talking. I mean, Larry's soft voice, he's gone through the program that gets him to speak loud. And it's big motion, big noises. That's what you want to do. And what happens is you're strategically thinking about it when you do it big. So whether it's boxing, whether it's bike riding, whether it's just a speech therapy, speaking loud, you need to be doing all these things big so you're thinking about it.
And making the...
And the last comment I'll make about this is, I did something the other day that I never thought I'd do. I bought my wife a set of pink boxing gloves. So she is involved in a boxing program now, too. It's a non-contact boxing, fortunately.
Dr. Donaldson, I saw you smiling, nodding your head. You wanted to add something to that?
No, I was just thinking of, other things. Another thought that did cross my mind is also with the muscle strengthening, like making sure you're doing those kind of free weights and things to keep the muscles nice and strong. I was just laughing because when he mentioned about the boxing, I just envisioned his wife chasing him with the boxing.
440.
Did I tell you to take out that trash?
That's right. Keep me alive.
1-800-940-2240. Ellen joins us from Norfolk. Hi, Ellen. You're on the air.
Hi. I want to thank Don. I heard him speak at the last week's Thursday afternoon support group, and it was wonderful hearing and being encouraged to participate in the stroll and roll down at the beach on the 9th, and to sort of help me. I've only been diagnosed less than 2 years, and it's still very embarrassing at times, but I'm feeling better knowing that the community is out there for support. And I would like to thank his wife for getting the pink boxing gloves because mine came in the mail yesterday. So thank you all, and thank you, Ms. Lee, for putting on this program.
Thank you very much for your call, and we wish you well. She brings up a really good point about the embarrassment of it. And Larry, I'm going to start with you. I mean, was it an embarrassing thing for you? Kind of what mentally goes on when you realize you got to talk with your friends and you got to go to church and you got to, you're out in the community and you're out and about?
It wasn't embarrassing because I owned the disease when I was diagnosed. I was not afraid to tell a judge that I had Parkinson's. I, in fact, was not afraid to tell a jury that I had Parkinson's. And I would tell the jury during the voir dire, if my voice goes soft, please forgive me. And usually the court reporter, somebody would tell me that I need to get my voice louder again.
Gotcha. So you kept practicing for how long before you retired?
I practiced for 6 years after the diagnosis.
Oh, okay. So you just retired?
Just retired
recently,
last June.
year. Okay. And so when you're out and about, I mean, do people stare? Do they? I'm just curious as to how the community itself, Don, reacts when someone has Parkinson's.
There is a little bit of that. I think a lot of it is when you're first diagnosed, you're still fairly you can be active. It's not something that is debilitating to put you into bed or something. You can still do things. You can still work. You can still Michael J. Fox. You can still be an actor. Locally, Sheriff Ken Stoley has told the community that he is a person with Parkinson's. Now, this is an elected official that's still doing his job. So people are still very much involved in life with Parkinson's disease after their initial diagnosis. So it's I think they're not embarrassed to tell people about it. It's just, I'm going to go out and live my life and continue on doing that. So they may just say, I don't need to really be it, and they don't want to see what's coming. So sometimes I don't want to participate in a support group because
I'm going to have to
I don't want to see where it's going to be in the future.
Okay.
And they stay away from that support group or maybe even a Parkinson's exercise class, which may be good for them because they don't want to see where it may be leading.
That's very interesting. Susan joins us from York County. Hi, Susan. You're on the air.
Hi. How are you all today?
Doing good.
Good. My father passed away last October from Parkinson's-related issues, and I just wanted to encourage everybody to go ahead, get all the information that you can. A big support group. I know we had family members that helped a lot, but it is such a devastating illness, at least it was for my father, that you really need to know everything you can about it so you're not taken by surprise by so many of the issues that come up, the dementia, the sleep problems. There's just so much involved, the medication you have to be on top of. There's just so much involved with the disease. You really need to be educated as a caregiver as well.
Okay. Thank you, Susan, so much for that point, and we're very sorry for the passing of your dad. But, Don, I wanted to ask you about that because we were talking about you're a caregiver. Mm-hmm. Your wife, Larry, is a caregiver, I would assume. What is it like for you as a caregiver, Don? What has changed in your lives? Well,
it's changed certainly as it's progressed. My wife was diagnosed in 2000, so it's now been 15 years, and we see the progression of this. I think the major thing is to stay attuned to what's going on in her day-to-day life now. Mm-hmm. As she may start something, she may tire quickly. So how do I help her finish that? Do I ask her to sit down? And there are times when that gets a little bit, I don't know, combative is not the right word because she's now got boxing gloves. But that she says, "Oh, I can do this," and so it's a balancing act at where she is now with her Parkinson's. And
what about support groups for the caregiver? Isn't that as much important as it is for the person with Parkinson's?
Yes, it is, and several of the support groups that we have locally. During the meeting of the people with Parkinson's, there is also a caretaker, caregiver. I consider myself a care partner. Okay. A caregiver can be somebody that can administer medical services. Gotcha. Also, I'm really a care partner for my wife, and we meet and we have. It's interesting to see how much is in common between the care partners that we have got to deal with. You know, and some of it is what do we do when, and how do we protect the person we love. But how do we let them still continue that independence? And that's really one of the major issues that we've got to balance day in and day out.
How about your wife, Larry?
I would say I still drive, but my reactions have slowed down. So my wife, whenever we're going anywhere, she drives 95% of the time.
Got you. Okay.
That's a major change.
Mm-hmm. Mm-hmm. Is that okay with you? My husband still does it now. I don't have it, and I still drive a lot.
She's a better driver than I am.
We've been talking. Go ahead, Dr. Donaldson.
One thing I did want to mention is that whenever you're talking about a big diagnosis of any kind, you got to always consider the patient's mental health. A lot of times patients, and it's tricky with Parkinson's because their affect is flat anyway, but 50%, up to 50% of patients have depression. And the symptoms can kind of change and fluctuate throughout the course of the day even. But it's something that you never want to ignore that piece, because that their minds are still sharp, but they feel this type of way. And so it's important, as a primary care provider, this is something I'm always looking for. Is this person depressed? Are they feeling hopeless? Are they feeling discouraged? Because that's something that can be managed medically.
Well, and we've been talking, Dr. Nass, both of you, this question about the medications, because we've mentioned all along that there are different medications that can be taken for Parkinson's, but what does it do if there's no cure? So, Dr. Fuentes, and then I'll come to you, Dr.
The medication is to slow down the motor symptoms. So in theory, they should help with the tremor, with the stiffness, and with the speed of the movement. It should help when the patients get stuck, for example, to make them able to walk normally. Right now, I think we are in a really good place for Parkinson's disease. The goal of the medication is to decrease that breakdown of that neurotransmitter, that it's that dopamine. That's the goal of the medication. We've got the levodopa, which is the gold standard. It converts into dopamine. And then we've got at least 5 different additional agents that we can use separately or in combination that add up and work with that dopamine that levodopa makes and the dopamine that your own body still has. In addition, we've got the new, at least deep brain stimulation available since 2002. We've got surgery to control sort of some of these symptoms. We've got trials with focused ultrasound, same thing. We've got a gamma knife to control some of the symptoms. So I think if you catch the disease early, if you start treating early, if you're very compliant with the exercise, you manage anything psychiatric that may also affect and inhibit you being as active as you should, there's no reason in 2016 for patients to end up in a wheelchair like it used to be.
Okay. We got a bunch of calls, so let's go to them. Harold joins us from Norfolk. Hi, Harold. You're on the air.
Yes, thank you very much. My wife was diagnosed with Parkinson's in 2007, and she's got to the place where she cannot walk, and she pretty much either is chair-bound or bed-bound. But I have a terrible time trying to keep her dehydrated or hydrated. She's just so dehydrated that she can't swallow water, and I was wondering what's the best way to combat that.
Okay, we'll get an answer from Dr. Fuentes. Thank you, Harold, for the call. He's trying to keep her hydrated. Do you have some suggestions?
The first step would really be an evaluation of the swallowing process. So they need to contact the neurologist, primary care, to see if there's any swallowing problem that could later on turn into something like pneumonia, aspiration pneumonia. You really want to prevent that. Hydration is definitely very important, but you need to find out what's refraining the patient from swallowing safely first. At least hospital-wise, we can use ice ships, right? But first things first would be check that swallowing.
Harold, have you had a chance to have her diagnosed with her neurologist to find out why she doesn't like to swallow?
Through all of that, she's been through the dopamine routine, and it just didn't help anymore, so we stopped that. And she's done through the exercise programs and slowly drifted off of that. But her neck, she just has a terrible problem swallowing, because that's the muscle that's really affecting her the most right now.
Did they happen to do a swallowing eval? Like a lot of times they have speech therapy in the hospital would do that, or a barium swallow exam to kind of see, look to make sure, what the mechanism, or where the problem is lying, and then secondly, based on that response or that result, then they can make a recommendation. Because if she's to that degree, dehydration, depending on how bad it becomes, you're trying to get into kidney issues and other problems, and she may need even, of course, far extreme would be a G-tube or something that could be, you could give her water and through that. But, have they done any of those basic swallowing evals yet? Yes,
we've had 2 speech therapists on 2 different times, and one of them did the electronic stimulation there to try to make it better and so forth, and it just didn't work. And now it's to the point where it's been a year now since we've had a speech therapist out here, but we've gone through that routine twice, and it just keeps getting worse.
Harold, can I suggest that you maybe give the your chapter Don a call for some guidance on where he could go? Could you give him a phone number?
757-495-3062.
Mr. Harold, if she's really having problems swallowing, she does need a new swallowing evaluation and check on the need to get into something like a PEG tube.
Yeah, because you may want to have whoever the neurologist is. Sometimes, depending on who's actually leading the show on that, if it's the primary versus neurologist versus you just reaching out to a speech therapist yourself. Somebody has to take the information, coordinate it out to say, okay, we have this problem. What are we going to do about it? So make sure whoever is coordinate that out, you're being in touch with them and just saying, because sometimes they may not know that things haven't gotten better, and they won't be able to do anything if they don't know that it's worsening.
Good luck to you, Harold, and thank you so very much for your call. We appreciate it. We got about 5 minutes left. I'm going to try to get a couple more calls. And Misty joins us from Newport News. Hi, Misty. You're on the air.
Hi. Thank you. I have Parkinson's, and I have 5 different questions. So
okay, I only have time for one. Thank you, Misty.
Just choosing one is the problem. But I was wondering, have there been any advances in nutrition and Parkinson's? Anything that works better or doesn't work, or things that should be avoided?
In terms of nutrition. Okay. What I'm going to do, Misty, is also give you the phone number to the Parkinson's Association to call for more help, which is 495-3062. But doctors, are there any nutritional things that she could do in terms of keeping her overall health? I would think maybe might be an option, Dr. Donaldson.
Just adhering to a healthy diet, low fat, low carb, just trying to keep the diet fruits and vegetables.
Okay.
And if you're in levodopa, then consider the protein interaction. If you're eating a food that's protein full, the medication is not going to be absorbed. So you should wait at least half an hour, 1 hour before or after you take your meds.
Okay. And
the APDA has a brochure on nutrition and Parkinson's that if she calls the phone number, we'll get that brochure to her.
Okay. And that's the American Parkinson's Disease Association, the Hampton Roads chapter. The number again is 495-3062.
Or can contact at the website hrparkinsons.com, hrparkinsons.com. You can get through the chapter through that also.
Okay. Is there something new? We've got about 3 minutes left. Is there something new going on in terms of research? Yes, Larry.
I wanted to put a plug in. We talked about the data and the lack of data earlier. There's an act in Congress called the Advancing Research for Neurological Disease Act of 2015. It's passed the House, but it's not passed the Senate. But it authorizes the Center for Disease Control to actually start collecting this data and put it into a form that we can use for research. It's been introduced several times in the past, and the Senate keeps turning it down.
The Senate keeps turning it down. Okay, so it would be helpful if we contact your senators and bring them awareness about Parkinson's and about this bill.
It's H.R. 292 and Senate Bill S-849.
Okay.
So that voting issue out there.
See, there we go again. We're back to the voting issue. Go ahead, Dr. Fuentes.
I just want to reiterate again about the importance of exercise. Only thing that slows down disease progression. Many Parkinson's patients, it's more than 50% of them have psychiatric problems, anxiety, depression, memory problems. You need to make your physician aware that this is going on so we can help. Polypharmacy is a big problem, so we do have to be aware of all the medications you're taking, avoid medication interactions. Some medications can make Parkinson's worse. in terms of management, again, I think we're making good progress with new medications. We're making new progress with new surgical treatments. We're working on gene therapy. So there's good research going on. We're trying to identify biomarkers so we can treat these patients that have the genetic predisposition to develop Parkinson's disease. So it's just an ongoing process.
One thing I want, and I want to get to Don very, very quickly for the last thing, but also patients should continue to work with their primary care as well as your specialists.
It's
correct?
a teamwork.
Okay.
Yes.
It is teamwork. You have something special coming up?
Yes, we do. One thing I'd like to say is there are movement disorder neurologists, which are really somebody you should go to, not just a general neurologist, but even a movement disorder neurologist who can deal with Parkinson's better. On April the 9th, at Neptune Park, which is at 31st Street in the oceanfront, is the Boardwalk Stroll and Roll.
All right.
This is put on by the American Parkinson's Disease Association. It is about Parkinson's. We have over 25 exhibitors, including Dr. Fuentes, who will be there, and another neurologist, and we have a lot of exhibitors. We hope people can attend on April the 9th at Neptune Park in Virginia Beach.
Fantastic. And they can find out more
and
information
they can
on your
find information
website.
at hrparkinsons.com.
That's fantastic. Thank you all so much for joining us today. We really appreciate it, and we'll be right back.
Hi, I'm LaShawn Merritt, and if you want to discuss the issues and celebrate the successes of the African American community, listen to Another View on 89.5.
Critical information today. I hope you all got a lot out of that. She's been accepted to just about every college she's applied to, has a 4.1 GPA, performs with the Mosaic Steel Orchestra, and has somehow managed to accumulate more than 650 volunteer hours over the last 5 years. I'm talking about 18-year-old Destiny Taylor Moyler, this year's youth honoree for the 2016 Hampton Roads Volunteer Achievement Awards. Lisa Godley gives us an inside look at Destiny's work in the community and her plans for the future.
Destiny Moyler's first crack at volunteering came while she was still in middle school. She'd quit piano, and her mother encouraged her to try steel pan drums.
I got into it in the junior level in the 7th grade, like the end of 7th grade. And I thought it was a lot of fun, and the more I played with them, the better I got. So I advanced to Mosaic Steel Orchestra. So we started having more events in the community, and I've been there for about 5.5 years now. It's like time has flown by. I'm predominantly on the double seconds, and so it's two beside each other, but each have like half the notes of the tenor pan, which is the one that's by itself with about 30 or so notes in it. It's like having two tires around in front of you with a bunch of notes in it, and they're chrome, so they're kind of heavy. I've been playing that one basically my entire time. It's just more fun to play double seconds, in my opinion.
Ironically, the numerous hours of rehearsal time and the performances that keep members of the Mosaic Steel Orchestra on the move isn't what caused Destiny Moyler to capture the Hampton Roads Volunteer Achievement Award in the 18 and under category.
I mainly volunteer within the children's hospitals and at elementary schools. I just enjoy helping other people. If there's a way that I can help someone, I try to do it. And I don't even need to be recognized for it. It's just an honor that I have been. I practically fell in love with it. It's a lot of fun for me, being able to help other people and not need anything in return. I see the kids and I try to keep them entertained if I can, but I mostly work with the doctors and nurses and office workers. This previous summer, I was in the residency office. It was a lot of fun because I got to see all the inner workings of a hospital and not just the gloominess and whatever that keeps people away from hospitals. It was a really fun place to be. It's like a giant playground.
The road to Volunteer of the Year has also taken Destiny down other paths, from helping build playgrounds to assisting in the classroom.
I volunteered at Sherwood Forest Elementary School for a few years, and I would go there after school and I would say to the teachers, is there anything you need help with, or ask if there's kids that need some extra attention, and I would tutor kids or help them clean up their classrooms or whatever they needed me to do, because I was just happy to be there.
In fact, it was the Mosaic Steel Orchestra's director, Anthony Haley, who submitted Destiny's name as an exemplary volunteer. And Destiny says she admires him greatly, but her role model is her mom.
She's the one influential person that's always been there for me and always tries to push me to my furthest limits and try to make me the best person I can be.
So what does the Norview High School honor student want to do after graduation?
I've applied to Harvard, Johns Hopkins, Rensselaer Polytechnic Institute, Howard, University of Maryland, Baltimore County, Virginia Tech, and Hampton University.
And Destiny has been accepted to just about all of them, with over $100,000 in scholarship offers. And she's looking at a major that she feels will allow her to utilize her passion to study many different things while fulfilling her desire to help those around her.
I'm going to probably go to college for computer engineering so I can find ways to help people and advance technology for the future. And engineering is a subject that requires all school subjects in one general area. And thought that would be a really great thing to do so I could use all my skills and strengths, but also be able to help people.
For Another View, I'm Lisa Godley.
And the only school that she has not been accepted to is Johns Hopkins, and she's on the waiting list for that. So how about that? Talk about a positive story. That's wonderful. And it seems the awards just keep coming for members of the Mosaic Steel Orchestra. The Virginia Symphony has named the Mosaic Steel Orchestra's director, Anthony Haley, as Music Educator of the Year. So congratulations to him as well. Before we wrap up today's show, a quick reminder that the last town hall in our Race Let's Talk About It initiative is soon upon us. It's Tuesday, April the 5th at 6 p.m. at the Fort Monroe Theater in Hampton. The topic is race, religion, relationships, and the hope for redemption. The town hall is free and open to everyone, but we need you to register to attend. Please go to WHRO.org/talkaboutrace to sign up, and I look forward to seeing you on April the 5th. Now, we shared some very important information today, so if you'd like to hear it again or share it with a friend, visit our website, anotherviewradio.org, and download the podcast. Be sure to friend us on Facebook, and I'm on Twitter at Barbara Hamm Lee. Next week, we begin our final discussion in our Race Let's Talk About It initiative. The topic, again, race, religion, relationships, and the hope for redemption. Don't miss this critical conversation on the intersection of race and religion in our country and in this world. Our theme music was composed and performed by Jay Sennett. Lisa Godley is our show producer. Victor Bowen is our audio engineer, and Melanie Booth answered our phones. I'm Barbara Hamm Lee. Happy Easter, everyone, and let's make it a great weekend, and we'll get together again next Friday at noon for Another View.